A brand new weight loss pill just got approved by the FDA, and it works differently from anything that has come before it. This is Foundayo, and it could change everything for people who have been waiting for an easier way to access GLP-1 therapy. Foundayo is the brand name for Orforglipron, made by Eli Lilly. It is a once-daily oral GLP-1 receptor agonist, meaning it works on the same receptors in your body as Ozempic and Wegovy. But here is what makes it truly different. It is a small molecule pill, not a peptide, not an injection. A pill you can take any time of day, with or without food, with or without water. No restrictions whatsoever. GLP-1 receptor agonists work by mimicking a hormone your gut naturally releases after eating. That hormone tells your brain you are full, slows down how quickly your stomach empties, and helps regulate your blood sugar. Ozempic and Wegovy do this through a peptide, a chain of amino acids, which is why they have to be injected. Your stomach would destroy a peptide if you swallowed it. Foundayo is different because it is a small molecule, not a peptide. It is chemically designed to survive digestion and still activate the same GLP-1 receptors. That is the breakthrough. Same mechanism, completely different chemistry, in a pill. In the Phase 3 Attain clinical trials, which enrolled more than 4,500 people, the results were compelling. Participants taking the highest dose lost an average of 22.9 pounds over the course of the study. Blood sugar control was also significantly improved, with A1C levels dropping by an average of 1.8% in people with type 2 diabetes. The FDA reviewed these results and granted approval, supporting Foundayo as a legitimate and effective GLP-1 option for adults with obesity or overweight with at least one weight-related health condition. Like all GLP-1 medications, Foundayo does come with side effects. The most common ones include nausea, constipation, diarrhea, vomiting, indigestion, abdominal pain, headache, and hair loss. These are generally consistent with what people experience on injectable GLP-1s. Most side effects are mild to moderate and tend to improve over time as your body adjusts. However, there is an important boxed warning, the most serious type of FDA warning, for potential thyroid C-cell tumors, including a rare cancer called medullary thyroid carcinoma. Foundayo should not be used if you or a close family member has a history of this condition, or a syndrome called multiple endocrine neoplasia type 2. You should also not take Foundayo alongside other GLP-1 receptor agonists. Cost is one of the most important factors for most people considering GLP-1 therapy. Here is where Foundayo stands right now. If you have commercial insurance and qualify, you may pay as little as $25 per month with a savings card from Lilly. For people paying out of pocket, the starting price is $149 per month for the lowest dose. Medicare Part D patients may be able to access it for $50 per month, beginning as early as July 1st, 2026. These prices are significantly more accessible than many injectable GLP-1s have been at launch. Foundayo is approved for adults with obesity, defined as a BMI of 30 or higher, or adults who are overweight with a BMI of 27 or higher, and at least one weight-related condition, such as high blood pressure, type 2 diabetes, or high cholesterol. It is intended to be used alongside a reduced calorie diet and increased physical activity, not as a standalone solution. It is particularly well-suited for people who want GLP-1 benefits, but are unable or unwilling to self-inject, or who have had difficulty with the food and water timing restrictions required by semaglutide tablets like Rybelsus. Foundayo represents a genuine step forward in making GLP-1 therapy more accessible and convenient. But like any medication, it is not right for everyone. Talk to your doctor or pharmacist to find out if it is appropriate for your specific situation. This is not medical advice. Always consult your doctor before starting, stopping, or changing any medication. If you found this helpful, follow Meds Decode for plain English breakdowns of the medications that matter most to you.